Hello, I'm Dr. Lippy Roy, and welcome to my show, Health, Humor, and Harmony. On today's show, I'll be reacting to an episode of HBO's Real Time with Bill Maher, where Bill and his panel talk about a few billboards posted by health departments in New York City and San Francisco about safe drug use. As an addiction medicine doctor and public health advocate, I found many aspects of Bill's commentary problematic, but it's also symbolic of the misperceptions that the public have about people who use drugs. I'm going to break it all down. Let's get started. So here's the clip, which aired June 3rd, 2022.
We basically have to say to homeless people what they say in bars. You don't have to go home, but you can't stay here.
Exactly.
Right.
Exactly. You don't have to go into the shelters, but you can't sleep outside. It's not safe.
There is this idea always that, we could solve these problems if we had more empathy.
Right.
Sometimes empathy isn't enough.
Yeah.
Right.
Sometimes too many rules, it doesn't work either.
Yeah.
But too much empathy doesn't work either. I live in New York, and I was on the subway the other day, and there's a new advert that the New York Health Authority has put up for heroin users, saying,
we
don't,
have it.
don't
Show
feel
it.
shame.
It's amazing.
Don't feel shame about being...
No, I have it here. It's, well, that's the fentanyl one.
Yeah.
Here, there's one in San Francisco. Can you...
Yeah.
Okay, we'll do that one first.
Yeah.
Don't be ashamed you are using. Okay, that's the first thing it says. Yeah, this is part of the problem of losing civilization.
Yeah.
Shame is part of life.
Yes.
We do this everything. Toxic positivity.
Yeah.
Everything is positive. Everything is not positive.
The New York
you
Health...
should be ashamed that you're using. That might get you to stop.
The New York... Exactly. The New York health authorities have been shaming people in New York if they haven't had their third booster shot, or didn't wear their cloth mask, or haven't put a cloth mask over their 5-year-old. But it's great if you're a smack user. You should feel real pride.
Yeah. Well, I mean...
Gee, I got it all wrong.
Start with a small dose and go slowly. I mean, it's a how-to to be a drug addict.
Yeah.
Test your drugs using fentanyl test strips.
Just do it with friends.
That's
do it
the
alone.
heroin
do
one
it
in
with
here.
your friends.
Yeah. No, this is the heroin one in San Francisco. Do it with friends. Use with people and take turns.
Yeah.
Try not to use alone.
So many parts of this discussion were highly toxic, judgmental, and wrong. Don't have to go to shelters, but you can't sleep outside. Okay, then where will they sleep? Are cities investing in affordable, safe housing with access to health services, including mental health and counseling, food, clothing, education, and jobs? Another statement, sometimes empathy isn't enough. Actually, we don't have enough empathy for people who use drugs. We aren't taking the time to listen to them, to try to understand their underlying reasons for using, which often involve pain and trauma, such as the loss of a child or a parent, severe illness or pain, physical or sexual abuse, unemployment, divorce. Most people, especially those who develop an addiction, often use drugs to self-medicate their pain and suffering. New York City Health Department poster that said, "Don't be ashamed you are using, be empowered that you are using safely." Bill refers to this poster as toxic positivity, and that as a society we need more shame. God, no. Studies actually show that shame and judgment are harmful and stigmatizing, especially for people who use drugs. People with addiction already feel tremendous shame and guilt, as well as sadness and isolation. They don't need entertainers like Bill Maher and political commentators like Douglas Murray, who clearly know nothing about drug and alcohol addiction, to pile on more shame for people who use drugs, who in fact deserve respect, access to evidence-based treatment, compassion, and support. Smack user. How toxic for Douglas Murray to use labels like smack user. In addition, junkie, cokehead, lush, and a whole host of derogatory terms are constantly used to describe people with a brain disease known as addiction. Would you ever shame someone with leukemia or thyroid disease to get their act together? No. Start with a small dose, go slowly. Test your drugs using fentanyl test strips, and don't use alone. These are actually all evidence-based harm reduction strategies that have been shown to keep people alive. The reality is that these posters created by public health departments in New York City and San Francisco are rooted in principles of harm reduction, which is a set of strategies and ideas aimed at reducing the negative consequences associated with drug use. Harm reduction is based on a belief in and a respect for the rights of people who use drugs. The goal is to meet people where they're at. Examples of harm reduction include a spectrum of services such as sterile syringe exchange, naloxone or nasal Narcan, condoms, referrals to legal services, food, clothing, and health services. Housing Works is a wonderful nonprofit dedicating to fighting HIV, AIDS, and homelessness, and which offers a range of harm reduction services led by Mr. Max Sepulveda. Full disclosure, I work with Max because I proudly serve as a medical director at Housing Works. According to Max, quote, "For me, the narrow-minded aspects of Bill Maher's comments are the notion that shaming someone is okay, and that the notion that the only solution to substance use is abstinence, which is proven to not work for everyone." Max, who has dedicated his career to creating low-barrier services to keep people who use drugs safe, went on to say that destigmatizing conversations about substance use paves the way to a long-lasting solution versus one that isolates and punishes people for their circumstances. Max goes on to say, "No one can ignore that substance use is an issue in our communities, but a selfish, narrow-minded, insensitive, uncaring, and derogatory approach to care is not the solution needed to address our common issues." Harm reduction also includes safer or supervised consumption sites, SCSs, also known as overdose prevention centers or OPCs. North America's first such site is Insight, which opened in 2003 in Vancouver, British Columbia. As of January 2021, Canada has 37 safer consumption sites. The United States, where over 100,000 people died of a drug overdose in 2021, has 0 until now. I had the honor of meeting Mr. Sam Rivera, the executive director of On Point NYC, which is the first publicly recognized overdose prevention center in the U.S.
So I'm Sam Rivera. I'm the executive director of On Point NYC.
And tell me about On Point NYC. What do they do?
So we provide an array of harm reduction services and other services to our participants and really the two communities overall. 3 actually, South Bronx, Washington Heights, and Harlem. So we're a harm reduction organization that provides basic needs like case management, connections to healthcare, assistance with housing, and then we get into our more deeper rooted services like syringe exchange, and we have a low threshold medical services as well. We prescribe buprenorphine for folks who need it or interested in trying bu. We have a holistic health program, which is really exciting, where we provide acupuncture, acupressure, sound therapy, massage therapy, Reiki, an array of health services that most of our people are never really privy to or can afford. All of those services are free. We also provide healthy and nutritious meals 3 times a day. And then, of course, we have the first 2 overdose prevention centers in the country, in the United States.
So when people say harm reduction, it's you're encouraging people to use drugs. What's your response to that?
We're encouraging people to stay alive. I mean, people are going to use drugs, and the folks we work with are active drug users who've been active drug users for a long time. What we're doing is showing up at a really crucial time in their life, especially now with all of the fentanyl in the drug supply and people dying at these high rates. People want to really attribute it to COVID. I think COVID is just a piece of it. It's really about what's in the drug supply and the inability of folks who are selling drugs to know how to really measure what they're selling to people. People who come in here have been using for a long time. All of our participants have been in detox and treatment, so I often get that. Like, Sam, just send them to treatment and detox. All of them have. And I'm not saying it doesn't work, but it's when they're ready. It's when they're ready.
Meet people where they're at.
Truly meeting people where they're at. Because I heard a bank say that once, right? So you have all these organizations and folks who say, we meet people where they're at. But is that really true, or do we give them limits to where they could be, right? For us in harm reduction, and not just us, harm reduction in general is the epitome of meeting people where they're at. Yeah. Like, this is how I show up, and we adjust to where they are. And to me, that's harm reduction. It's a loving, supportive, passionate environment that cares for people. We provide a health intervention, specifically in our overdose prevention program, a health intervention that keeps people alive while creating a community, while creating a space that's healthy and loving, a space that's inclusive, a space where people become part of a community, and it's really been exciting.
Thank you so much, Sam.
You're welcome.
During my tour of the East Harlem site, their other location is in Washington Heights in Upper Manhattan, I observed many services that On Point NYC offers an underserved population. Laundry, shower, food, a holistic center, a medical clinic, including Hep C testing and vaccinations, as well as the actual OPC, where people can privately use drugs using clean supplies. Medical emergency supplies, including naloxone to prevent an opioid-related overdose, and an AED are easily accessible. I found the facility to be remarkable. It reminded me of Vancouver's Insight, where I had the opportunity to visit in 2018. For those of you who still need convincing, here's the data that truly convinced me that overdose prevention sites are much needed healthcare centers that save lives and keep communities safe based on over 70 facilities around the world. There's a decrease in IV drug use, decrease in overdose deaths, decrease in HIV and Hep C transmission, an increase in connection to treatment, no increase in drug-related crime, and 0 fatalities. In fact, sites like On Point NYC have reversed over 300 overdoses. That's over 300 lives saved. So how can you get involved? You can donate to, volunteer with, and learn more from On Point NYC, Housing Works, the National Harm Reduction Coalition, Harm Reduction International, Drug Policy Alliance, the Global Commission on Drug Policy, and many more. Well, that's all for today. Here's your joke of the day in honor of Father's Day yesterday. Why did the dad take an extra pair of socks to the golf course? In case he gets a hole-in-one. Tune in Wednesday, 3 p.m. Eastern, when I'll discuss the importance of hydration. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.